Sichuan, you are doing the holistic dentistry, right?
Yes, I'm
Yeah.
a biological dentist
So
for 25 years.
25 years.
Yes.
And what's the differences between the
Yes.
general, the regular?
Big difference. So a general dentist is focused on the teeth.
Yes.
I'm focused on the entire body.
Yeah.
So I brought you a little gift. This is my Meridian Chart.
Ah.
So this one we give to the patient, and it's on our website, gonaturaldentistry.com. It has the connections between the teeth and the organs.
That's interesting.
Yeah. So for example, and this is very common in Asia, and a German doctor came up with a Meridian Chart. And the way it works, for example, I have a patient that has prostate issues, urinating a lot, or the woman cannot get fertile. And we do an examination, a three-dimensional CT scan.
Yeah.
And anytime that a patient has a blockage on the teeth, for example, a tooth is dead, there's no electricity, there's no connectivity with the organ.
Yes.
That organ is not working.
Yes. Okay. So by fixing that tooth problem, you think the organs can resume the function?
A lot, 99% of the time.
Oh,
yeah.
That's
so
the first
we
time.
we have patients, for example, we encourage people not to get root canals.
Okay.
Because a root canal is a tooth that is dead.
Okay.
So they have put formaldehyde, which they call formicresol. Formicresol is a mummifying agent that is used in gross anatomy.
Yes.
When you go to medical school, right?
Yes.
So they mummify the dead bodies with formicresol, and it's very toxic. So I couldn't even go to the room because it was so toxic. So when a doctor does a root canal and they put formicresol on the tooth, the entire tooth and the bone dies.
Yes. Okay.
So the patients come. A lot of patients come with breast cancer.
Oh, there's a connection with that?
Yeah, all the teeth that are connected to the breast are the molars, you know, the second molar, number 2, number 3, number 4, you know, on the bottom also you see you have the breast here, right breast, to number 28, 29, and then you have on the upper left 13, 14, 15, and then you have 20, 21, so the molar area. And unfortunately, most patients, you know, they remove those teeth that are dead, and then we rejuvenate the area with plasma, with stem cells, and then we tell them to do acupuncture, hyperbaric, all the things to open the meridians up.
Yeah.
And you know, unfortunately, I would say we lose one patient a year to breast cancer.
Because of those.
It's been too many years, too advanced.
Okay.
And then when the patient comes, it's just too late.
Okay.
So we encourage the patients. We had recently a 28-year-old with colon cancer, and she came with a bag. She flew from Seattle. The mom did research, and she said, fly to Fort Lauderdale, and we removed the tooth that was, you know, blocking her intestine. She had a root canal on tooth number 19. So, you know, that's the large intestine. She said the moment I took the tooth out, literally she felt something was released from her body. And the doctor, you know, was able to close her. Already they cut part of the colon.
Yes.
But, you know, she changed her lifestyle. She relocated from Seattle to Fort Lauderdale. And she quit her job, was very stressful. And, you know, she changed her entire, got all the mercury out, her gums are healed. So one of the things that I love about you is that when I come here, I am always on the go, flight or fight, you know, the nervous system, go, 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 go. So when I come here I get the deepest, most peaceful sleep.
So that will balance the immune system.
So I said, I want you to tell us how is it that you do that? Because all my patients are grinding their teeth and breaking their teeth. So I want them to see you because I want you to be able to relax them like you relax me.
Yes.
So tell me about what you do.
So that's kind of anxiety issues, right? So when we have this stressful situation and people multitask or do so many things at the same time, you stimulate the sympathetic nerves, and the parasympathetic nerves become weaker. And in that condition, they always have higher level of stress hormone. So when they are exposed to stressful situation, the whole nervous system will be hyperactive. So the heart rate going up, and the breathing is not as deep, and that also can lead to hyperactive immune system.
Mm-hmm.
And that's how people get autoimmune, chronic inflammation. So using acupuncture, we can strengthening the parasympathetic nerves, and that way, when they are exposed to higher level of stress, they can stay calm, and their hormone cortisol or adrenaline will not go up too high. And I have a question that when I go to clean my teeth, I was lying down there, it's very relaxing, and when they gently cleanse the teeth, I feel like when they touch the gum, I feel more relaxed. Do you think there is a connection there?
Well, that's a very, very good observation of yours. So that means she has healthy gums.
Yeah.
Because what happens is that the gums are connected to all the different, like the lymphatic, the gums are connected to the blood vessels and the bones and the jaw and the arteries to the heart and the lungs. So if she's feeling relaxed, it's because she has very healthy gums. An average person that comes to my office, no matter what age they are, usually they have gum inflammation. So when the gums are inflamed, they don't have that reaction.
Oh, okay.
Yeah, they're gonna have more of they're gonna have bleeding of the gums, which is linked to heart disease. And we have people as young as in their 20s and 30s that have unhealthy gums, and the unhealthy gums are causing inflammation on the heart.
Yes,
They get pericarditis,
yeah.
but if it's been there chronic, they get endocarditis,
Yes.
bacteremia, and now you're talking about a young person that's fit with high blood pressure.
Yes.
So, you know, it's wonderful. Very few people have the reaction that you do, but yes, we have patients that get totally relaxed. They go to sleep when we get the gums done, but they're not infected.
Okay.
So that's a sign of your health.
Oh, thank you.